If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you. All right. How you doing?
I'm good. It warmed up here a little bit in Nashville. So,
Yeah.
I mean, my mood's affected by sun and warmth. So it's been a good week.
Yeah, I think you and most of us, man.
Yeah.
The weather's been awesome. I was walking around yesterday in a t-shirt and so happy about that. And it feels like things out of DC are slowing down a little bit. They're not really taking a U-turn. The general sentiment is still job cuts, budget cuts, Doge, but not fast and furious with the executive orders and net new news. It's starting to slow down a little bit, and maybe they're actually doing the work that they spent the first 2 to 3 weeks of their
talking about.
Yeah.
I think that's right.
Yeah, which is kind of nice on the psyche, quite frankly, because whether you're for it,
this is whiplash. Everything is all new. Yeah,
that's exactly right. It doesn't matter if you're for it or you're against it. It's a tremendous amount of change coming very, very quickly. Right. So, So I don't know. Things feel like we're moving into spring. We're getting out of the.
Yeah, we're back in the studio. We're back to no travel. Do the show.
Yeah, it's nice. And we're prepping for our annual summit in about a month, which is really going to be exciting. And we'll have our LPs from across our funds at that event, so that'll be great.
We're going to record a show there too. Right?
Yeah. We're not going to say
our listeners will get to at least. Hear a little bit for the live audience and everything.
Exactly. There'll be some great sessions, and we're going to do a show there, and we'll have a great guest for that show lined up already. So, I don't know. Nothing else to talk about. We should just get to it.
Yeah.
All right, let's dig in. We're skipping the economy this week just because there was nothing of substance to talk about. There were a couple of articles that were about the sentiment and the vibe, but that's not worth covering.
I think that's right. It was just a lot of policy, a lot of other activity, but the economy is kind of bumping along. It's not super great, but it's not terrible. It's just kind of going along.
I mean, at the time of this recording right now, it's, the streets are red on, in terms of all the different markets are down. The VIX is up, I think, 20% right now.
Yeah.
So
the yield curve inverted in a couple different time differences, but not all the way. It's just kind of like yellow lights flashing.
Yeah. And people were talking about that last week, the yen carry trade being something that we need to watch out for, maybe having a repeat of what we had with the Nikkei.
Mm-hmm.
But look.
Yeah, I think that's for March.
Exactly. All right, so let's start with VC. There's a fair number of big deals that happened. The first one, company called Camber, but previously was called Juniper, raised $30 million for medical claims automation.
Yeah, and Andreessen Horowitz, big VC firm, led the deal. They're expanding in geography and specialty. So they're moving, I think they were behavioral health, and now they're moving to home health and long-term care, substance abuse disorder. So adjacent to behavioral health, but new markets. So good. I mean, I think a good space. And
One thing that I thought was notable was that Y Combinator joined their Series B.
Yeah.
And I know that Y Com has a later fund, but I rarely see their name attached to a Series B. So I just thought that was interesting.
Yeah, especially when they didn't launch the company. I thought their fund was more for their companies.
Kind
that
of an
they
opportunity
have.
fund, right?
Right.
So that's interesting, and probably something to take note of and watch for Y Combinator's evolution.
Yeah.
Maybe beyond just doing their early stage cohorts.
And into healthcare. I mean, they haven't been a huge healthcare.
No.
I mean, they do a little bit of healthcare a year, but if they get in more into healthcare, that'll be interesting.
Yeah, I think AI turns them on about healthcare, right? Because all the other labor intensive things.
Yeah, it's too hard.
Yeah, not in their wheelhouse. Charta Health secures $8.1 million after turning cold emails into profit in just 60 days.
Yeah, so the two founders built and sold a company in AI. They sold it to OpenAI. And then they sort of decided to look into healthcare, but unlike a lot of Silicon Valley founders that just kind of turn on an AI computer and start doing healthcare things, they actually got credentialed and got trained in medical coding as actually a human coder and went through that process, talked to a lot of healthcare professionals, and then they used that experience to build a coding tool.
Fantastic. Bain Capital's lucky to be investing in them. $8.1 million seed round led by Bain. And yes, I mean, I think one of the things I've learned over the course of the last 5 years is how important subject matter expertise is in the founder.
Yeah.
Sometimes they see an opportunity, but they don't understand intricacies of where the pitfalls really lie. And the fundamental difference is, did you work in the space or not? Actually, and so these guys are really smart. And look, I actually think this is a really interesting path, because I've heard a different company that actually came from the Middle East and has now become stateside, and they did the same thing. So when I first heard the story, I thought it was them, and I looked at the founders and I'm like, no, this is not the same company. But this idea of going and working in healthcare, here's the thing, it's not that hard to get certified to become part of the healthcare workforce. And then you do it for a year, and now you're a subject matter expert. I mean, it doesn't take that long.
And you see all of the, let's call them friction points.
Totally.
But you know them in a much more like a visceral way than just like looking at a website. And
exactly.
About it.
And probably after like your first 4 to 5 months of, training, getting your certification and starting a job, you probably can start the side hustle in like 5 months, and be coding at night while you're working during the day or whatever. Right. So it's a really smart model here. And again, congrats to Bain for being able to get into that deal. Avandra lands $17.5 million to build out federated imaging network.
I think we all believe that imaging is going to be one of the early adopters of AI and be able to be much more effective. And so they're sort of training models and gathering lots of images to train on. So interesting.
Wearable defibrillator maker Kestra Medical plots $150 million IPO. So this is interesting. The company has raised, again, it's another Bain Capital portfolio company. They've previously raised $196 million. Don't know a whole bunch of those names, but Bain Capital, T. Rowe Price. So there are some more enterprise names that are on this list. They've raised almost $200 million. They're IPOing at $150 million. It looks like Bain's going to own 52.8% of the company, and there are other owners. So, I mean, what do you think they're offering? Something like 20% of the company, maybe 20, 30% of the company. So that would value it at north of $1 billion.
Yeah, but they're claiming they're going to IPO on NASDAQ in the fall. I think it's in the fall.
Mm-hmm.
But there's no banker listed, so I don't know if Bain is just trying to float an IPO themselves or they just didn't announce the banker. But the size of raising $150 million is a pretty small IPO.
Yeah.
You mentioned, I had not noticed it, but that they've raised private capital in excess of that, which is, again, not typical. So great to see a healthcare IPO get filed and be planned. And it's a little bit different than I'm used to seeing with IPOs.
Yeah. And it could just be that Fierce didn't think to list it. You just didn't think to list the banker,
right.
But it is interesting that the banker wasn't named.
Yeah.
Right. All right. Wall Street Journal story here. New Dream Exchange aims to list Black-owned companies. I think this is a very interesting headline from the Wall Street Journal, because then you read the article and the founders of this exchange clearly say they're race neutral.
Yeah.
So
it's the headlines. I mean, I think you know this. The headlines are not written by the journalists.
No.
And this headline is
well, no. Hold on. The headlines can be written by the journalists. They're certainly not written by the subject of the article. And as I read it, I've kind of jumped ahead, but it just stuck out to me as I read the headline, knowing what the article is about. So the article is about two Black businessmen who are based in Chicago.
Yeah.
Okay, based in Chicago, which is actually where I think the New York Stock Exchange is moving their exchange to Texas.
Oh, really?
Yeah, because it's not a net new that they're sending to Texas. I think they're moving the one from Chicago to Texas.
Okay, interesting.
So that's just an interesting point here, but they want to create an exchange that is for small businesses.
Yeah, there used to be the American Exchange and the Toronto Exchange, which were both sort of for smaller companies, and I don't know that they exist anymore. But
right.
We need more publicly traded companies. We need more places for smaller companies, like the one we just covered, $150 million raise. I agree. This is not, I mean, they happen to be two black guys that are starting it, but they say pretty specifically that it's not designed for black-owned companies. I mean, you can be black-owned, but any company they want to give a home to. I think it's interesting that we're now seeing, the Texas exchange is probably more of a conservative movement thing, and this is probably more of a liberal movement. What I don't think it's necessarily black, but it's going to be in Chicago and more on the liberal side.
I think this is great. I mean, yeah. I want to see more things that are not on the right that have a real economic focus, and an economic focus that is about businesses, right? Not just about investing in whatever, man.
Yeah.
Businesses, business creation, value creation, economic value creation should not be a partisan thing. People on both sides of the aisle should be really into that.
Yes. And there's a need for different exchanges. I mean, the thresholds to be on the New York Exchange or NASDAQ are high and expensive. And so having another exchange where they are vetting companies and it is regulated, but it's a lower tier where you can be smaller, I think would be really healthy.
Yep. Totally agree with that. All right, House passes the GOP budget, teeing up enormous tax and spending cuts. The numbers on this budget are staggering. $4.5 trillion in tax cuts and $2 trillion reduction in federal spending over a decade, which is sort of lining up the major elements of President Trump's domestic agenda.
Yeah, and it was, I mean, they don't have a lot of extra votes to spare, and they pushed it across the finish line, which was surprising.
217 to 215.
Right.
So, I mean, they barely got it done.
Yeah. And I think it was a lot of whipping up their support and horse trading to get it done.
Yeah.
But they got it done. So we'll see how it evolves. The Senate has not done their side yet. And so they have to do reconciliation, you need to get both bills, I think, identical. There's a lot of concern. We'll have the next story about, how are you going to find $2 trillion in cuts? HHS, and particularly Medicaid, has a big target on its back.
Yeah. Medicaid has a multi-$100 billion target on its back. Obviously, that freaks out a lot of people because it's care for the most vulnerable. And it's also a lot of the viability of our safety net hospitals. Mm-hmm. Our nonprofit hospitals have to do a lot more charity care, and a lot more, their payer mix is much more leaning towards government pay than commercial pay. And even, more and more for-profit hospitals, as Medicaid payments were brought up to be more on parity with commercial payments through supplemental payments.
Yeah.
So it sort of lines up the whole industry, quite frankly. And in this article from Fierce, they highlight that you had kind of all the big associations there. So the American Hospital Association, obviously, that's your nonprofits. Federation of American Hospitals, that's your for-profits. America's Essential Hospitals, that's your safety nets. Right? So there you go. They're all sort of there covered. Yeah. You have the Association for Community Plans. And they're messaging sort of at different levels of intensity based on how much of a target is on their back, based on how big their total surface area is that's government pay, right?
Yeah, so the Federation members are less concerned. Yes. But they're concerned. They're concerned. They don't want it cut.
No, of course not. Of course not. They're concerned, but they're less concerned, whereas America's Essential Hospitals, it's like 100% of their business, right?
Right.
So they're extremely concerned about these cuts. Look, I mean, everyone is going to be watching this very closely in the healthcare space to see where this is going to play out. There will be a ton of advocacy, a ton of lobbying happening. And I agree with you. Getting it, how it will all play out in the Senate is going to be a completely different ballgame than when it was in the House. So we will stay tuned. This week's big presidential action, executive order coming out of the White House was on price transparency, a relatively short executive order as they go, but basically saying, hey, we put price transparency in place during Trump's first term.
Right.
Biden continued it, but was not necessarily very aggressive on it. Of course, America's healthcare ecosystem was reeling from COVID, so it makes sense that you were trying to kind of get the hospitals back
to the top focus. Yeah,
you're trying to get the hospitals back to stable ground. And look, when we look at nonprofit hospitals, we've talked about the credit ratings. We've talked about how they've turned around the losses into wins. There's very few that are struggling the way that they were 3 years ago. So it feels like the hospitals are now in a much better position. But you stack potential Medicaid cuts, 340B issues, labor issues, and now
overhead cuts.
What's that?
NIH overhead cuts.
NIH overhead
really
cuts.
Not every hospital, but
but all the academic medical centers, and then now you throw in this price transparency bit, right? Which is, it's like they've already done a lot of work on price transparency. The next story that we'll talk about is the HFMA analysis of this, which is to say that gearing up for January of this year, the hospitals already did a bunch of work on price transparency to get estimates out there for the services. And now, they're having to be pushed to move towards exact prices on things. So,
and the other change from Trump administration 1 was the consumer friendly format versus machine readable format. A lot of the prices that are out there now are in JSON format. They're pretty hard for a human to digest unless you are a developer and can pull the code down and then create a report. And so they're improving that, or maybe they're adding requirements depending on your perspective. But having it be readable for a kind of a normal patient population is probably useful.
Yep. So look, we'll watch this one closely as well. It's an executive order, and I think the main point is that we're going to start enforcing this stuff a lot more. But again, there's a lot of things coming at the healthcare ecosystem right now, all at one time. It feels like just the theme is pressure. Yeah. So we'll see how we come out on the other side. I thought this was an interesting one that you found. Blue Cross Blue Shield Association report addressing hospital pharma costs could save over $1 trillion in the next decade. You don't say.
Yeah. So Blue Cross Association, I mean, they're good people. But they produced this report basically pointing fingers at health systems and pharma as the best place to save $1 trillion. And it's not that I disagree with them, but it's, they have a dog in this hunt. They want the cuts to come out of the other side, and they're not objective in this analysis, I would say.
No. And neither is the AHA or
right.
I mean, I'm just giggling because the provider payer dynamic
it's funny.
The longer you stick around in this industry, the funnier it gets, right? So this was
so site neutral payments was the big thing they came up with, where you should pay the same for a procedure, whether it's inpatient or outpatient. I agree with that.
Look,
but I'm not sure Blue Cross is the one to push that.
Well, listen, I mean, they have an audience, so they have an audience, making more people aware that site neutral payments are a potential thing, and that is a real potential thing for this year.
Oh yeah,
that's a very real potential thing.
I mean, I don't think that Brad Smith and others in the Trump administration were unaware of that until Blue Cross told them about it.
Of course. The Trump team weighs pulling funds from Moderna bird flu vaccine. This is from Bloomberg.
Moderna and the whole mRNA thing, I think, is being really challenged now. And the Trump administration is looking for cost savings, and they are likely to pull the $590 million contract for Moderna to work on a bird flu vaccine. I think that's likely to happen. So Moderna's stock is really in trouble. And I'm not sure.
Well, look, I mean, the bottom line is they're just in the crosshairs.
Yeah.
They're in the crosshairs. So Which is so interesting because, like, you just think about how these narratives evolve in spite of the facts. You know, Operation Warp Speed was under Donald Trump.
Yeah, that's right.
You know, Moderna was born under Donald Trump.
Yeah, the COVID vaccine was what made the company.
Yeah, but all, you know, the way that things were handled through the Biden administration and the lockdowns and all these other kinds of things, it's like, you know, they're no longer in vogue with the right, you know. So here we are. Axios, telehealth advocates turn up the pressure as Medicare deadline nears. So this is coming up very, very soon, this deadline. I didn't realize how soon it was coming up, but March 14th.
Yeah. The concept that telehealth visits are good for patients, good for payers, good for providers, and should be done. I think we all agreed in COVID that we should do that. And we are waiting now for it to be extended, but March 14th is fast. And so there's a lot of my portfolio, a lot of healthcare providers that rely on telehealth visits being reimbursed. And I don't know who is looking to change this, but they haven't extended it. And so people are lobbying, and I think it'll get extended, but March 14th is pretty soon.
Yep. Agree. It's look, it's one of those things that my dad had his first telehealth experience with his diabetes doctor, and he loved it.
Of course he did. He didn't have to drive down and everything.
He's like, it's so much more convenient. This is great. I love it. To talk to the doctor right from my bed. You know what I mean? He loved it.
And it's better for the doctor.
Yeah. Now, but he happens to be able to get to the doctor.
Yeah.
You know, that's because of the resources and the network and other things that he has.
Yeah. So it's a convenience thing. Correct. He might go every other time to the doctor.
But let's be really clear. His state of health would not allow him to do that on his own. So if he was not resourced as he is, he could not do that.
Right.
He could not do that. And there are many people his age that, you know, have the same physical limitations and are not resourced as he's resourced. So this is a very real access to care kind of no-brainer for our aging population. And it's just kind of like this one just feels like if you try to do cold calculation on budget on this particular one, this feels particularly cruel to me.
I don't think it saves money. I mean, in the long run, even like a year view, I don't think it saves money.
Right. And the healthcare economics and like what kind of acuity will you end up, you know, dealing with? It
is, I think, completely positive to have telehealth as an option. And I don't see who would be against it.
Yeah, agree. Trump memo directs federal agencies, HHS, to fire more employees and submit agency reorg plans. This is from Fierce Healthcare. I think I said this in the episode when I kind of returned back from the road. But, you know, I know a lot of people who work in the government and the federal government.
Yeah.
And I don't know a single one who has not had an encounter with Doge yet. It's like, so for people who don't know people who work in the government, like
they all have had encounters with
every
them?
last one of them.
Yeah.
Every last one of them. Yes. Every last one of them has had an encounter with Doge.
Yeah.
So it's not just like a social media thing.
No. I mean, I agree with that. I mean, the thing that is different about Doge this has been tried a lot of times to cut government spending, is Elon and all the people he's bringing have really powerful tools to pull detailed data on each program, each person, each wire going out, each employee at a scale and a level of granular detail that we've never looked at that before. And some things like waste, fraud, and abuse in Medicare, I think we should catch every fraudulent claim and stop it. Right? We don't need to just sort of grab the most egregious ones. But for the employees, they're real people. We need to sort of treat them maybe a little differently. But they're running fast in all the different departments. So I'm not surprised.
No. So, I mean, look, we're going to see some brilliant people unemployed here in the not too distant future. And I certainly hope that we have the capacity in the private markets to absorb those people and put them into positions to leverage all their knowledge and experience, which could be invaluable in the private markets. I mean, because we can't do anything about the fact that they're going to get fired. I mean, they're going to get fired. Like, that's just. So the best I can hope for is that we can absorb that talent. Right. Yeah. Especially in the healthcare innovation space. I think less the establishment, less the incumbents, and more like actually the fixed healthcare part of things. Like, let's work together. Healthcare dive. This is a little breakdown on how Medicare Advantage enrollment has been playing out so far between December and February. It's a short window, but you are starting to see some winners and some losers emerge. United Health continues to grow and dominate overall in terms of enrollments. It's incredible when we refer to Humana as like the MA player, and in February, UHG's enrollment was almost twice Humana's. I mean,
even though they're doing 100 things, right? They're doing everything, but they're still double the biggest pure player. Like
UHG is
they are just a really strong machine. I mean, people are upset with them, people are happy with them, but they are big and pretty efficient.
There's not a close second. In our industry to them. There's just really not.
So Medicare Advantage, I think, overall is still growing, but more slowly than it has grown in the past. So the rate of change is slowing. And then you're starting to see a difference between winners and losers. United Health and Elevance are gaining share, and Humana, CVS, Centene losing share.
Yeah. I mean, the pure players losing share, some of it, I think, has to do, we saw Centene last year talking about moving out of certain markets.
Yeah, and Humana. Yeah. They both are, maybe, I think, I don't have this sourced, but my guess is that they're moving some out of some markets to get to more profitable areas. And so some of the decline was calculated.
Yeah. So anyway, just sort of interesting to kind of see how enrollment is stacking up, and that I think generally speaking, UHG, although they have all the data and they are going to be smart about the markets that they pick and the members that they enroll, I think their scale enables them to take on more members, right? Just that breadth of premium.
Yeah, their scale
base,
and
premium base
and Optum is it?
Yeah. Okay, this is from Yahoo Finance. Walgreens breakup inside the private equity takeover that could reshape the pharmacy giant. So this is probably the best story I think I've heard about Walgreens since we've done this show, because the Walgreens story has just been going down just like their stock price.
Right.
But Sycamore Partners is pushing ahead with its bid to take Walgreens Boots Alliance private. So there's basically 3 businesses inside of this conglomerate. There's the U.S. retail pharmacy. There's a UK-based Boots chain, and then they've got a specialty pharma unit called Shields Health Solutions, and the idea here is to take them private and then break those 3 into separate businesses, which is probably a good thing.
Yeah, I think it is a good thing. They shouldn't have merged with Boots and acquired all this stuff, but that destroyed value. So now splitting it up and having business that can focus is good.
Yeah. So look, I hope this happens. I'm just, how could you be a shareholder of Walgreens and want to be along for the ride any longer?
Right.
You know what I mean? It's been.
I don't know who's still holding it now.
Yeah. I mean, but it's been brutal, right? Yeah. Okay. Semaglutide shortage ends as FDA sets deadline for compounders. So we've been talking about this for a while.
Yeah.
We covered the very audacious but well done Super Bowl ad that Hims and Hers did, and apparently all it did was point attention.
Too audacious.
Yeah, right. Yeah. All it did was point attention to the fact that they're out here selling this thing that we don't actually have a shortage of.
Yes, that's right. And so I think this is hard for Hims and other compounders, but the right thing. I mean, if you have IP protection, you should be protected from other people at that kind of scale competing with you. It just doesn't. It allows the market to work, and so I don't know. I mean, I don't want to have expensive Ozempic particularly, but that's a different question than whether they have the right to sell illegally compounded competitors.
Correct. That's a totally different question.
Right.
It's a totally different question. And I think we've been talking about this for a while. We've had conversations with people who basically thought like, what's the FDA actually going to do?
Yeah.
And, I think this FDA is going to protect corporate interests where the law is on their side.
Yeah.
So, this is, I think Hims and Hers stock price on this news of the shortage being ended went down 26%.
Yeah, in like an hour. It was
brutal.
Yeah. And I mean, I feel bad for them, but it was pretty clear that it was not legal to do.
No. Like the idea that you pushed so aggressively into a business line that you knew was like an exception.
Yeah, there's a short window of time.
Yeah, and somehow you were just going to like draw public sentiment to like support your case.
Yeah, that wasn't a good strategy.
Yeah, and in the meantime, so let's just talk about the downside. Part of the downside is certainly financial for Hims and Hers, right? I mean, loss of revenue, loss of stock value, but all their members who were previously getting it through them.
Yeah, they have to figure out something else.
Now they got to figure out something else. Right. So that's kind of the tough part there,
Mm-hmm.
right? Eli Lilly plans to spend $27 billion on new U.S. plants. So this is all part of the reshoring effort that is, I think, two sides of a coin. On one side, there's a bunch of tax cuts to sort of drive manufacturing reshoring, and on the other side, there's tariffs to sort of disincentivize continuing to do globalized business. So Eli Lilly's CEO Dave Ricks said this is the first time in 40 years, more than 40 years, that Eli Lilly has set out to build a new site. And, so in order for them to continue to do this, they need extended or improved support of this kind.
Yeah. I mean, I think it's a national security issue. I mean, we have to have sources of pharmaceuticals that are not from China and India. And we don't right now.
Dude, the story that do you remember we were covering the story about, was it amoxicillin? And how we were going to have a shortage because like we can't
make it.
Not only we can't make it, we can't keep our manufacturers in business,
right?
Because they can't compete with the Indian manufacturers. That it's not that we can't make it; we can make it.
Oh, we have the technology to make it. We can't make it at the price points that would work.
We can't make it at the price points that would work, and therefore we can't keep our manufacturing.
Yeah, it's a Tennessee-based firm, I think.
Yeah, it was in East Tennessee. Yeah. So like, look, I mean, And this is why I said when we first started talking about the tariffs thing, I said, listen, I don't know enough about tariffs, and I still don't. I still don't know enough about tariffs, right? And I understand that there are downsides to tariffs, 100%, right? But like, can we have an honest appraisal of the state of resiliency of America? We are not resilient. Like if we don't import stuff, we're screwed.
Yes. And
we're fragile. We're not anti-fragile. We're fragile. And so at some point, somebody had to be the bad guy and do this politically. At some point, somebody had to put some measures in place to get the country resilient again, Yeah.
And I think there's no question about that. The question is, how do you do it in a way that is slow enough that the companies and the job workers and the economy can sort of evolve into it while not making it so slow that nothing happens. And it's a complex system. So you put a tariff in, it has all these downstream effects that it's hard to know.
Yep.
It'd be good to go slowly. I don't know that Trump is slow at anything, but I love that Lilly's building 4 sites.
No, it's great. It's fantastic. It's really good. AstraZeneca's breast cancer drug shows positive results in late-stage trials, so always a good thing. Analysts anticipate a sales potential for the drug of $1.5 billion in 2030. Apparently, this drug is showing better progression-free survival compared with the standard of care treatment.
Yeah, breast cancer is a huge problem, and more solutions is great. I've read this article 4 times. I can't understand all the science around it, but it's positive.
Yeah. So good news, and we'll track that in the coming years. All right, Health and Us. First stories from the Wall Street Journal: Why we don't trust doctors like we used to. The subtitle: Patients often feel ignored and complain about disjointed care and a lack of communication. Duh. I mean, do we even need to read the article?
No.
After that headline?
No. And it's a sad state of the world, I think. I mean, simultaneously, doctors have come under pressure to do a lot more volume where they don't have time that I think most doctors I know would like to spend more time actually with their patients.
Of course.
But they are under extreme pressure for RVUs and volume.
Absolutely.
And then simultaneously, we have TikTok, Google, Instagram, other sources promoting all kinds of information, some of which is true and some of which is vaguely kind of true and some of which is not true.
Also, this is important, and I think becoming more apparent as we continue to see doctors just opting out of the health insurance complex and just going cash pay.
Yeah.
We're realizing that accepting insurance mandates a particular standard of care that may not be like the most cutting edge or the most patient friendly or the most exploratory to actually like track down what might be going wrong with somebody. And several of the examples in this story are about, people who came in with a particular symptom, and for all the reasons you mentioned, right? The doctor has 15 minutes with you and has to spend half of it documenting things so that I get everything right for the claim that's got to be filed, right? And what, when they hear something, it's like, okay, is insurance good? The calculus in their head many times, if they're billing insurance, is like, is insurance even going to pay for this?
Is insurance going to pay for it? And do I need some lab either to protect legal liability or to buttress my defense of the insurance questioning it? And I think our system is set up. I'm not blaming the payers. I mean, I think there's a lot of hate around the payers. Their job is to try to be the offset for that. Yeah. But it's a problem that we don't have physicians that have training spending time with the patients to help them navigate these things.
Yeah, look, no system is perfect. We're just we're highlighting,
just describing some of the issues with it.
We're describing some of the issues with the system, right? So this is not a problem for doctors or the providers, you know, as an organization that they work for, or the payers. It's like when you have a system that has to work at scale and costs all this money, and you're trying to kind of manage costs and all this, and you're trying to get a lot of volume because you got to treat a lot of people, and you don't have enough docs, and your panel size is too big, and all the things, right? This is what you get. Yes. This is what you get. And I've talked multiple times on the show about the fact that I have a concierge doc because I sort of ran into this situation with a doc that I loved and trusted for 10 years, and was not entirely off insurance, but like was generally speaking, integrated medicine, very, like very, very thoughtful. But in this one experience that I had that given other things that were going on in my life, and what my symptoms were, the bottom line is I was afraid. I was afraid that something was really, really wrong.
Yeah. And you weren't confident that your doctor was looking at everything like he needed to or she needed to.
I did not feel that my fear was received.
Yeah.
And understood, right? And and again, back to the resources. I'm resourced well enough to sort of say enough of that. Like I'm going to go get to a doctor who is going to listen to everything I say now, and it's going to cost me more money, but like, they will listen to everything I say. Right. You know what I mean?
Right.
And that's I don't love that. I don't love that, but
it's not scalable across the country.
No, of course not.
Problem.
Of course not.
Yeah.
First measles death reported in Texas outbreak. So an unvaccinated school-aged child died after being hospitalized in West Texas. This measles outbreak is very, very sad. Something that we hope does not break out, but is, I think, part of the national debate conversation around vaccines in children, right?
Yes. The measles vaccine, I think everyone should get it. I think it's very clear that it's highly contagious and dangerous especially for pregnant mothers. It's very dangerous. That doesn't mean every vaccine is the same. And it's such like this hot topic that you can't talk about different vaccines in a way that is scientifically based. But no one in the world, but no one in America should die of the measles. That's really sad.
Yeah. Well, look, our conversations are, especially when it comes to how we are learning, it's broken down into posts and tweets and things like that. And, we use words like woke, like that mean like it means anything.
That has anything to do with medicine.
Yeah. Or like it even means anything. Like what is woke?
Yeah.
What does it even mean? You know what I mean? So of course we can't have a conversation, a nuanced, thoughtful conversation about vaccines. I mean, you can on podcasts where you can have long form conversation and stuff like that. But generally speaking, you can't have it on cable TV. Those conversations are way too short.
Yeah. Yeah. And it's back to the last story, in the pediatrician's office, you can't have an hour-long conversation with your pediatrician about vaccinations. They don't have the time and they're not qualified to talk through it all.
Yeah, that's right. All right. And then New York Times did an incredible story, but it's not just a story. If you happen to be reading this in the browser, I can't say for sure how it works on the phone, but if you read this story on the browser, the interactive graphics that they use to articulate it are incredible. This story is about organ transplants and the waiting lists and how they are working and more importantly, how they are not working, and how the people who are quote unquote next in line sometimes end up getting passed over in the 11th hour after having waited for very, 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 very long. And so this is a very controversial story, but they do a good job of highlighting the real challenges in the transplant space right now.
Yeah, and it's there's been a lot of work for 30 years to try to figure out this question. We have a limited number of, they're talking about kidneys, but hearts, any organ, and we have more people that need it, unfortunately, than we have access. And who should it go to? And what's the way you determine that? And so there's lots of combinations of factors, their existing health, their match with the donor, whole bunch of things. And what I was really shocked about is that, I knew something about this. I know it's complicated and there's lots of pieces, but we still waste about 20% of the organs, just don't go anywhere. And so they tried to, 10 years ago, they redid the whole system that opened up some of these gaps where someone might jump in front of people in front of them in line because they have A, B, C, and D. And they I think, accepted those possibilities in order to make sure more kidneys got to a patient at all, and we didn't just waste them.
Yep.
But it hasn't had that effect. We're still at 20% of the organs are not given to anyone.
Not placed, yeah.
So we haven't affected that sort of lost opportunity, and yet we have all these other kind of unintended consequences now where it's hard to know who's going to get it, and it feels more random than it needs to be.
Yeah. Yeah, it's a hard story to read, but I think
but the graphics are really, because it's a hard thing to just talk about, but the graphics, so if you're
the numbers don't do it justice,
yes,
but the graphics do.
Yes, that's right.
The graphics turn numbers into people.
Yes.
Which is very helpful.
Right. Yes.
Which is very helpful. All right, I thought this was an interesting story about red light therapy, getting the green light sort of. I mean, you asked me if I use red light therapy, and I'm kind of like I go to like
you test
Restore.
A lot of things.
Yeah, I test a lot of things, and I go to Restore, and my coach uses not my jiu-jitsu coach, my strength and conditioning coach, uses red light, and has sort of said, hey,
it's supposed to help healing, recovery.
For healing, like if you've got like a strain or something like that, you kind of use the red light, and it's supposed to stimulate the healing process. I mean, I'm one of these people that's like, if it's not gonna harm me, I'll try it. You know what I mean?
Right.
I'll try it. It's like, and I'll see for myself. Now, these things are in these wellness lounges, right?
Yeah.
Which now are all over the country. Restore is probably the biggest nationwide brand of these, but there's
a lot.
At this point, there's a lot. There's many of them. And there's red light in basically all of them. So, it's like a lot of people are doing this.
Yeah. Yeah, I think there is anecdotal evidence that it was really helpful. There's some animal studies that it's helpful. And I think I agree. It's not, I don't think there's anyone saying that it's going to be damaging. So I think if it helps you, that's good.
Yeah. All right, into the AI rundown. So Anthropic, finalizing $3.5 billion funding round. I don't know how you call a company that's raising $3.5 billion.
And valued at $60 billion.
Yeah. Anyway, they're finally getting this round done. DeepSeek kind of threw a curveball at the whole AI space for a minute there. But isn't it funny how like the news cycles are so short?
Yeah. Oh yeah, they're back. Everyone's back. Raising money.
That's right. Yeah, no big. Took a week. Take a week off. Let this DeepSeek thing kind of run its course, and then we'll all kind of come back and raise our funds. So $3.5 billion funding round, $61.5 billion valuation.
Yeah. I think I've said several times, the scale of this investment and the valuations are just hard for me to get my head around. Like, is it that much better than an open source free model? I don't know. I'm not sure. But look, if they get to AGI and there's some magic moment where like all of a sudden it is, then it will be right.
Well, I'm thinking more and more, and we're going to talk about OpenAI, I think, here. But I'm thinking more and more that this is not as much about which model is better than another model, and more about A, what the model's good at, and B, how trusted will this model be in the enterprise? And I think in America, OpenAI and Anthropic, and I'm trying to think, is there a good third? Maybe Grok.
Not Google?
Gemini, yeah, Gemini, and then Grok. So probably those four. And I wouldn't have said Grok before the Trump win, but now that Elon is, basically in the White House, I'll put Grok.
Gives him a chance. Yeah.
I mean, between that and also the data center in Memphis, powering Grok 3 and all that kind of stuff. I mean, all four of those models, I think, can be brought into the enterprise in very integrated ways that can pass the compliance and all the sorts of things that a DeepSeek will never do. Never do.
I agree with that. Yeah.
And look, you and I were both around when, Linux, when everyone realized, oh my gosh, Linux is more powerful than Microsoft when it comes to being a server technology. And Red Hat wrapped a corporation around it. Yeah. And then Novell did SUSE Linux. And you were there for that, right?
Yeah.
And it's like, dude, did it hurt Microsoft?
No.
Like, how much is Microsoft worth today?
Yeah.
You know what I mean? So, and how much is Red Hat worth today? I mean, they're a company, but like, not a very big one. So it's like, I think the open source models, just like open source software, are great for us. They're great for startups. They're great for programmers. They're great for researchers, right? They're great for anyone who wants to be able to leverage this technology and not have to pay licensing fees. And we should have that class of software out there. But there are going to be many enterprises that are going to want to replace many human workers with digital workers. And I think those businesses, I think about like the big four accounting firms.
Yeah.
Dude, their compliance has to be through the roof. They can never use one of these open source models. They have to use something that's like got a company behind it with all the, certifications and verifications and all that kind of stuff. But they want to replace their human workforce with a digital workforce. Big time. Like they're not even, I won't even say what I've experienced in the last 3 weeks on that front, but like, let's just for sure say this is something they want to do. Right. And I think that's where these valuations are really coming from, right? I think it's the idea that these companies will continue to advance these models. They know that they're not going to get startups like us to pay when we can use DeepSeek or Llama or whatever. They don't care about that. They care about the defense industry, the manufacturing industry, these really, really huge industries where they cannot, the aviation industry, the big accounting and consulting firms that have to serve these industries, and where they need a company behind the product. So that's kind of where I think the valuations are really.
Yeah, I think that's fair. The thing I'm just struggling with is the cost to train a model and the cost of inference that they're running is much higher than they're charging. So I don't see how they
we don't really know what their model for the enterprise is.
Yeah. So if they stop training new models and they create a product that is less expensive and works for enterprise, maybe that can work.
That's the only thing I can come up with to validate the.
But the difference between Claude 3.7 and DeepSeek or Llama, even like a year ago Llama, is just not that much.
Okay, so let's just talk about where I think we violently agree. I don't think anything is going to replace the consumer distribution that OpenAI, Meta, and Google, and let's throw Microsoft in there as well for their Copilot stuff, already have. Like OpenAI is the standalone name. ChatGPT.
Yeah.
That is, if you want a standalone brand.
Yeah. Everyone, you walk on the street, someone would know that brand.
ChatGPT, right? That's the standalone brand. And then the distributed brand inside of existing apps, that's Meta.
Yeah.
And Google. And to some degree, Microsoft.
Yeah.
And, Apple is just working with OpenAI.
Yeah.
And embedding ChatGPT, right? Because it's the best standalone AI brand.
Yeah. And Claude is really a Amazon proxy, I think.
It's an Amazon proxy, and it's also like for programmers.
Yeah. Yeah.
It's known for writing the best code.
Yeah. Yeah.
I'm just trying to steel man the valuation.
Yeah.
You know what I mean? Like, I'm not saying I would pay for it, but.
Yeah. So maybe they can create a software fine-tuned version that is sold on AWS, and it has that use case.
Yeah. I mean, if they can get contracts in the universe of what Palantir is getting,
yeah,
then that's like legit. Amazon announces AI-powered Alexa Plus. We were talking about this before we started the show. I put Alexa in the same category as Siri, which was a little early to the party with a very subpar product.
Well, both were pre-LOM.
Yeah.
Yeah.
Yes. So early to the party.
Yeah.
And not a great product experience. Mm-hmm. And I think it's hard to overcome that.
Yeah.
Now, right? So look, there are definitely some people who use Alexa in their homes. I don't think it's that many.
Yeah. I mean, I have 2 or 3 Alexa devices, but I never use them.
Do you ever use them?
Yeah,
I've got them. Exactly. I've got them too. Yeah. I don't use them, So look, I think they have to do it. It's table stakes. They have to do it. What would be interesting in this article, do they talk at all about whether or not Claude is underneath it?
They don't. I don't think it is. What they talk about is their access to your buying history and what you're watching on Prime and all of your personal information that Amazon knows about you being embedded into the LLM, which might be scary. I'm not sure I like that. But that they're presenting it as an advantage.
Yeah, and I guess I just don't even know like how that plays into me wanting.
Yeah.
Yeah, I'm just not clear on how that plays into me wanting that anyway, right?
Yeah.
So CNBC, NVIDIA sales grew 78% on AI demand. Company gives strong guidance.
Yeah, so they had their earnings announcement this week. They grew at 78%, and that was down from the 96% last quarter. And so, I mean, I think nothing grows to the moon, right? Like it has to come down from where it was before. And the stock, was off a little bit, and they just are going to need to keep delivering at this huge level. But I mean, the numbers, they're absolute, even the percentages are maybe coming down slightly, 78% quarter-over-quarter growth, and the revenue, for the fiscal year is $130 billion, 43 in this quarter. It's staggering numbers.
Yeah, and we're going to talk about some stuff that Meta's going to do that I think is only going to increase that.
Yeah, that's right.
This is a really important cautionary tale. So this is a story in the Wall Street Journal about a gentleman who's a Disney worker. He downloaded an AI tool and ended up hacking his password manager, and that's it.
So he went on GitHub, which I have done 40 times in the last year, and downloaded an AI image generation tool, which created images for him. But it also was really just a front to this cyber threat actor. And what really scared me is it broke into his 1Password, which is the tool that I use to manage passwords. And then that sort of brought the bad actors into the Disney corporate system. So it brought not everything down, but Disney lost a bunch of data from that.
Yeah, brutal. So, I mean, look, be careful what you download on your computer. Make sure you've got antivirus stuff. He had antivirus stuff on his computer. It didn't catch. The first antivirus program he had running didn't catch it. He added a second one, and that found it immediately. So, look, just you got to be careful with this stuff.
Yeah. So it just, I think I like some of the open source tools, but you need to be really careful about downloading stuff that you don't know where it came from.
Now, in here, I will say one thing that they do mention in here is that his 1Password was not itself protected with two-factor authentication. And,
Yeah, so that he should have that.
Yeah, there's a certain level of security that you really need to kind of put on something that is that important, right? So please secure your stuff. All right, BNY, America's oldest bank, signs multi-year deal with OpenAI, right? This is where I think the value is going to actually come from.
Yeah, they are just sort of, embedding themselves in, it was the federal government last month, and now it's a Wall Street bank. BNY is a huge, really established bank. And every time they check off one of these, then it's more likely they get the next one.
Mm-hmm. Tencent releases Turbo AI model. It says it's faster than DeepSeek. Of course, Tencent's going to compare to DeepSeek. But yeah, did I tell you that when I was in Riyadh, I saw like a Tencent skyscraper?
No.
Yeah, it's really interesting to see like American tech companies have buildings in the same financial district as like Chinese.
Yeah, that's kind of interesting. Right?
Yeah, it's just kind of an interesting thing that you would never see in America.
Yeah,
right. So just kind of an interesting thing. But I mean, look, we've said everybody's going to have their own models, their own frontier models, right? So of course Tencent would have their own.
Mm-hmm.
Yeah. How would you think about the Tencent one? Like kind of similar to Amazon? I mean, they're much they're kind of like Amazon plus Meta as a business.
Yeah.
So, right.
Yeah, I think there's a big Chinese tech conglomerate. I guess.
Yeah.
Amazon plus Meta is pretty good.
Yeah, because they've got like the whole Alibaba thing, but then they've got the whole WeChat thing.
Right.
So
the WeChat is the thing that
it's the everything app.
Right.
All right, 2 stories about Meta now. The first is that Meta is projected they're going to spend $200 billion on an AI data center. This story came out of The Information, which almost nobody is going to have a subscription for, but we keep it because every once in a while they get a good scoop on Silicon Valley.
Yeah, Apple came out with a big announcement today. Meta came out with Lilly came out with an announcement. So, the Trump effect, I think, is causing some investment. I don't know I think some of these might have been happening anyway, but Meta is aggressively building capacity, assuming that AI is going to be really impactful and they'll need the supply.
Apple had an announcement too. I mean, it's not an AI announcement, right?
But it was data centers.
Yeah.
And Zuckerberg, in the article that people won't be able to see, he is quoted saying, had rather have excess capacity and have spent more money, even if he spends it too early, that he doesn't want to be caught without capacity.
Yeah, I think that's right.
So they're going full steam into this.
I think that's right. All right, and then finally, Meta is releasing Aria Gen 2, which is a new model. Is that right?
It's a new product.
This is their glasses.
It's the glasses.
This is the
Ray-Ban glasses.
Okay.
It has technology models in it, but it's a hardware.
I've worn these.
Oh, you have?
Did I tell you about that?
No.
So I have a friend who works at Meta,
okay,
and so he's got the glasses.
Yeah.
This is the best glasses thing I've tried yet. For sure, they're getting real close.
It looks badass. I mean, it looks really good.
They're getting real close.
They have a blind lady shopping, and she's blind, right? So she says, "Can you show me the red onions?" And there's a bunch of round fruits and vegetables, and the glasses are really helpful for that use case.
And the speakers, which I think is probably the most impressive thing. The speakers, actually, the camera is pretty crazy too. Like, because it can it's got a little camera that you can barely see, but there is a camera on these things, and the quality of the pictures that it takes is like really good.
And it knows where you're looking.
Yeah.
Too.
Oh yeah. But the speakers on them, I mean, you really wouldn't need AirPods.
Yeah.
Because you could talk on the phone with them, you know. So this is kind of the first time I've seen Meta on the hardware side, like finally kind of get to a place where I'm like, okay, this is, and look, they did it by partnering with Ray-Ban, a real glasses company, right? I mean, which is.
Yeah. And they look pretty good. I mean, they're not like a Google Glass form factor.
Those were ridiculous.
Right. So
those were ridiculous.
It's.
No, listen, they look good.
Yeah.
I've seen them. I've worn them. Yeah. They look good.
Yeah.
They're Ray-Bans.
Yeah. Yeah. So it's probably early still, but in another 5 years, people are going to be wearing this around all the time.
People are going to be wearing these.
Yeah.
People are going to. Yeah. I mean, finally, I came to the conclusion after experiencing these, like, no, it's coming. It's definitely coming. Because here's the deal. Unless you like really looked at somebody's glass, you wouldn't know. Yeah.
I mean, you can see he's wearing them right there. You wouldn't. They look like just slightly bigger, but you wouldn't notice it if you didn't know to look for it.
You wouldn't notice. You might think he bought some slightly bigger glasses.
Right.
Yeah. All right. Solid show. Do we have any cool guest episodes that are getting ready to come out?
Yeah. So we have Stuart Clark from Premise.
Oh, that's great.
Premise is a huge, primary care employer site-based company. Not a lot of people have really known much about it, so I dig into it with Stuart Clark, who's the CEO, and they just are launching a sort of a new plan with their employer partners, so that you would have insurance through them. So that'll come out Tuesday. I think, and then we have a VC, Right Side Capital. It's maybe the next week or the week after.
Okay,
sure.
Good.
So,
the Stu Clark episode. That's
on Tuesday.
That's next week.
I'm real excited about it. Yeah, it's in a couple days.
Awesome. Well, I'll be tuning in to listen to that. And thanks for partnering on the show. And I'll see you next week.
Yeah.